And so say, call Doctor Hon was one they were few.
I am say only in town. The phone correspondent with any message.
Now they hospital Hon Doctor
I
and
don't get him.
if you don't get him,
The same thing.
you can still go to the hospital. You don't need to get your doctor before you can go. If they have emergency department. In the case of
I last went and they admitted me. So after that admission, they discharged me. That one I was not feeling nausea. It was the blood was coming a bit, and they admitted me in the hospital. So after that bleeding, when they admit me and it stopped, I came back to the house. I'm okay. So almost, I now start. Mr. Feeling sad here. We are there 2 to 3 days today. Mr. Feeling knows the bed. Now we will say moja bami.
so you still have to report back to the hospital. Huh? You still have to go back to the hospital. You don't need to get the approval from your doctor before you go.
Okay.
Why?
Okay.
Okay. Okay. Okay. Did you call hospital back? Call hospital back to your doctor. Go and see your doctor now. Go catch your doctor say one show. They say still I deal with no feeling. And your doctor back open the year you baby I will call antenatal no. It is a doctor on no liwa. Still, wait me ako ama omo after amo. Mudi obi any abre no say. Okay. Nti yɛn afei yɛnsua kakra yɛnhwɛ ebi ba so a mɛfa mo but ebi nya maayɛ no let's keep on learning we are live on YouTube and of course on TikTok baabi a wopɛ biara no wotumi hwɛ wɔ hɔ ɛberɛ a yɛsua deɛ question bi a ɛbɛba baabiara no yɛbɛfa ɔsɛ please I'm 36 weeks and my baby head is still not down what can I do you don't necessarily have to do anything akora no ɔbɛtɛn of course wobɛtumi atry sɛ wode wo nan bɛgu pillow so na raise wo nan no kakra woda a ebetumi aboa ma akora no atɛne pɛ nwom bi bɛn no na bɔ ne nwom obetumi ahyeke ne ho in that no obetumi atɛne but if we 36 37 mostly ana yɛ difficult sɛ ɔmbɛtɛne nti no you can just try but wantɛne a sɛ ɔmo hwɛ na sɛ obetumi awo afo ase a ɛbɛmo awo afo ase sɛ ɔmo hwɛ na sɛ wontumi ngo mfa wase a then of course na ɔmo ayɛ CS na yɛyi wo ba de ama wo nti na da bia me sɛ ɔbaa ɛno na yɛbɛ discuss yi ɔbaa sɛ wonyinsɛn pɛ fa hyɛ otum sɛ cesarean section is an option. Haji, are you? Good afternoon.
Actually, my problem is let's say 20 weeks. That's still my mental movement.
20 weeks there and che be and just relax. Don't worry yourself. Why?
Okay.
Yeah. Okay. If we 16 weeks, copim a year 24 weeks, muhono, obete banka. And this when you're 16 weeks, when you're 20 weeks, now want to obanka. Don't worry yourself. Okay. Was say please. I don't know if I'm pregnant or not, but I always have cramps. Sister, saa baby a you are still ready. What about your sabro fu ibi aba na me sheda nti wase. I don't know if I'm pregnant or not. I mean, if you don't test, how would you know that you are pregnant? So the 21st century, a baby actually na say wo pregnancy test strip no kura wunya bi. Then there is in abundance. Baby will be you just go to the pharmacy. Seconds, they be crowd. You just go home and test it yourself. You don't even need any special way be answer what me test. It is only maybe our husband patron who say ade we menyimwana I find it difficult to, It mean if you are feeling that you are pregnant, just go and test it. That is the best thing to do. Why? Yeah. Queen, you.
Yeah, hello.
Hello. Hey, the rare hawk.
Yeah.
Welcome on YouTube. Yeah, good afternoon, sister.
Good afternoon. Yes, please. I did CS 3 days ago, and my BP keeps on going higher. So I don't know.
You did CS how long ago?
3 days ago.
How long ago since you bro papa? English for no way. How long ago, bro papa? How long now? And I said, we can man to us so be we can go be ante. Now is me am ko fa me ho baby say. The Red Hawks, because I'm back. Okay, and see what? Hey man, Papa, remove you what? Remove the go. How long? How long? Eh? How long ago? Me tell me another moves as a macan was as NBC. Okay, eh? Me, Mtimbacho, me wo YouTube. That's answer TikTok. And why open YouTube no question? Why open TikTok no? But I share YouTube. I know follow me. Why? Hmm. And sister, ubi pino na e wo hodada. Ah, wo mado ato do so asa na say afi na aba.
No, it was there. It was there. I went for a checkup and they
Oh,
realized
Elena.
it's high. So I think it was 32 weeks. And they said because of that, they need to do CS and remove the baby.
Oh, okay. So you were having
After that, too, it
preeclampsia.
keeps on going. Yeah.
Oh, I see. I see. I see. So what it means, let's say, you have to go back. If the BP is still going high, you have to go back. You have to go back for them to, review maybe your medication or whatever. And you better so come back if the BP is still going up. Okay.
Okay, sure.
Not because 3 days and check. And that's a cost through the that's why I cost through the I'm sure. Some come back normal show. Then they will try to stabilize it for you. Very important. Why?
Okay, sure. Thank you.
Okay.
Hello, midwife.
Yeah. Ah, nah, give you one fan baby.
How long ago? Pacho will go question. Pacho me bano.
Mrs. Danso, request you before. Cute why dear pa. Only be bianco baby sa someone come back and yes and dear no better. The beer some in a matter of war. Only yes and dear better. They may west say how long ago. One foul, what the question send the brand me WhatsApp. Me you are no. Oh, hapa de Omaha. Send the question the brand me WhatsApp. Me you are no. So this can so come home, faka home bra. Or say, I'm 41 weeks and no sign of labor. No, no be. But until then, now midwife I. Well, doctor is saying, Mrs. Dan, so you can join to talk. Well, doctor is saying 41 weeks they should be doing something for you. Either say they are on induction and that's on monitor. Now I said time no that's so na ebi a yɛbɛma abrɛ kakra aka ho some few days na yɛahwɛ sɛ wobɛtumi awo anaasɛ wonwo. I have tested but it doesn't show any line. That's why I'm asking if I can go for a scan. And sister Rafia in Dubai, if you are not very sure, why a test no baako mmienu ɛna ebɛtumi abasa wɔ nyam. Because if you are feeling cramps, ebɛtumi abasa wɔ menses na ɛpɛ sɛ ɛba. That is why you are feeling cramps. Let us understand say you will be a friend premenstrual syndrome. So menses beba oba menses beba signs na wo feel extra say asa wonyem no. The same signs ni bi ho wo feel be ya wo say asa wo menses beba wo feel no. Sa sign na bi wonyem a wo ta hu sa signs bi. Me lifu mu ayedu, me bofo no me fefe pimples abegu me na acne agu me nim me didi bebre me ntimi ne di me teta rough fluctuation and I can say flatulence. You fluctuate. Say sir, you pass gas. What a town rough. Obi menses beba or experiences anima nemani. Obi so nyam fufra or experiences anima nemani. Nti no so what test na sa won nyam dia. Ebet ma be say o menses na ebeba. Nti na sa dia na eyo sa. So you can wait for some time and see if o menses na eba ana bibi. Was say I'm 36 weeks and sleeping anytime. Oh, so they are normal. Okay, Mrs. Dan, and Dan, into you.
Hello.
But good afternoon, Yanko.
Pacho, Miss Omidia, no. That was last year. Na me call hospital. What I say? Ombe ni CS.
So we are discussing. Mpacho chen kakra, ante chen kakra, ante. Mpacho chen kakra. Mo kasa ya muntie. Ante mpacho chen kakra. Mpacho seconds. So if you are here on YouTube, mpacho chen kakra. Remember, if you are here on YouTube, we are discussing cesarean section and fibroid. So if you've got any question for me here on this platform, you can bring it as we learn together. Okay. If you are here and you don't understand the local language, but you are very comfortable with English language. This is what I'm saying. So we are discussing cesarean section and of course fibroid. If you have got any question for me this morning or this afternoon, wherever you are, you can bring it up for clarification and all of that. So yes, yeah, means saying any awo honsem. Yeah, yes, cesarean section. So by call any CS. It is a ha. Na say wo on titwi na. Yes, you know betim do the aba. Titwi so a fabra na yenyiwa no. Ye wo TikTok nso saa na TikTok nso ye ka no ewo aha. Madam Yanko, me film.
Pacho, good afternoon once again. Said and I make a mechanic tree to me expressing myself here.
Elaine, I will feel you. What?
Me na omucha miska no mo say mo fibroid mo nti omo je ma wo a ombe twa na o meyi ene akra ne preko nti me ni me kunu ya accept e me nya men cha de yakọ last year December ho no ana ekoba say afi do mo si meet me apachi nti we do ma anya me fibroid nsensem nti akoda nti mpese me busa say me safe na.
You have to ask your doctor this question, my sister. You have to go to the hospital to ask your doctor. I cannot answer this question, my sister.
Okay.
Because
omo booking me na for you. Ama me ko tia anesthesia bibia injection e ade afi do dide na me be wonu na asesa akoye za afi da waka me liver. Ama makopushia pharmacy me koye me wonwe. Since then so meaning they happening to me about inside the honor. Say fibroid no so best no kwa me trust him bi anso bi. And mommy, we are planning to see about next because when you 1 year, last year, no, 1 year, December.
So we then also call hospital for now, no doctor. Say, doctor, as I saw, I think that is the best. Let me say, no. On the question, we will move. I know me, I know, I be out because what, yes, we are no, means me can be apart from the making because pay the okay, they can grow. A better than met me after everything is fine with you. So I say. Because me who be there, me near assessment there, me so just the mere fact to say what call adena yanya you. Nti ada na okra first of all, mo pesa mo bi mu, nka ne papa mu a, ka wakọ hospital. Unu ukunu na say wa, wakọ akọhwe, wakọ akọye the necessary investigation. I say ampa, everything is fine with you to carry on with pregnancy. But just say wakọ keke akọ bi sese mpacho me me mama approve as say oh ampa ko, me akọ na akọye na akọye problem. Do you say me na me ya na say wa. You get it? So some of these things now, I'm try say we will go to the hospital to clarify things. Why? Obia no ho be chiwa to ho. Na say me mo ba ha na me ka kire wa no so me mo wow. Obia so nchi ho to ho. Everything about medicine consent. Consent to bibia. Nobody will do a surgery. Consent to. It is never possible and it is never done anywhere. Why? Okay. All right. All right. Jessica, I'm battling you.
Good afternoon.
Good afternoon. See, I feel we are cutie. You bet for 1 or 2 dia can hona for your course na esua de kakra. Why? Yanko Jessica.
Na me see me without say. Nancy, I said me look for. Emunye du first can be na me mentity bia na ka me look for then ke mo yedu. They say you better 4 months in here. Me wo hwe mu ha mu say ke to akra ka ho. Na me say problem bia na. Me do ba nyu enu.
Na wo bisa wura, ukunu so mu hwa wo say nketo ama na.
Me mu sha no.
Nti busa so no yo okay dia problem ni say.
But I say.
Wo busa wura na so yo okay dia say wo say we problem dia. So wo busa no so yo. Say wo ba bia wo ndede wo ho. Me say me say wo bisa ukunu na so we problem dia say ne no anu wo say we problem.
Nikuno ni problem na me na mo ko me say ayeketwa ma ni so bi me that's what mo say ya ke to na ti mi ba ne sa
It's even sapa, especially who breastfeed we are.
sa na me wo da so o
Kafra, it's me sapa. Look for the say. The say the bia na obe menstruate a unu fum be edu. Then the any hormonal changes. Oh, we dey no anu ponu no ama me. I Jessica, wo the bia out me life is now. Questions here be say dey. They say the teacher muscles need to measure unu funu mu ana say. Ah, similar. Okay, sister Mbacho yenti o. I say I'm 36 weeks pregnant and sleeping all the time. I think some of you question we are no. So we any problem there, sister. And not they say yeah. Gifty, Mr. Gifty, user. Okay, so only so dia mo yan den na pay use yan de kakra. Okay, so back to CS, cesarean section. The na abena no. Abena de hini. Abena so why fresh pa o. Ene me go wanim no kra yan sam kitwa. Asam ni abena why come. Abena wa ware. Abena na wa he. Asam ni mo. Ni nkomo kakra. Ni na ka ho. Caleb, welcome. Abena kura wako musa mfimi musa nso wo hefa kan ka smart share. Sharifa Samben. Okay, into Yanshe, let's look at some of the indications for CS. At the end of the month, Dr. Akasa Okoye cesarean section. Very, very important. And no is CS via higher than into Ubi Waha, Unimumpo say advanced maternal age, a indication for CS. Advanced maternal age. It's the same. Says a mamia, the first time I walk on order. So, Linfield Kwelimu, it could be an indication for CS. So, advanced maternal age is one of the indications for cesarean section, so to speak. And you know, Doctor Yan assessment in the area. After the assessment, we conclude say, because we mean say no, may CS. We feel Kwelimu dodo. Ahoɔden no wɔ fam. Nneɛma A, B, C, D nti no, mɛpɛ sɛ mɛyɛ CS. Obetumi ka sɛ daabi doctor mempɛ CS, mepɛ sɛ me try vaginal delivery. Oh, abana any ibedi nkomo why? Ibedi nkomo. Minua be maybe bi ano me do why? Say ni ibedi nkomo why? Ibedi nkomo pa. Ayana am yedi nkomo. Sim bi wakura say me catch Robert ntimi kan no aha no. Ni bibia na say e kan wo online you know. We obetumi ahum na yedi nkomo kakra na ade. Ni na timi boa. The insua de, you say the insua de. Ntimi kan ni na why? Okay. Nti yɛn nso aso nti no advanced mathematics musu wa munya de mo yɛ de na sita yi wa Helena o de na wa yɛ yi aka na atom advanced maternal age mean nkasa da bia na te saa o be nyame yankasa advanced maternal age ebetumi am yɛ CS again da bia me ka kyerɛ sɛ ebe CS a enema bebree sometimes no what dwene kora nkɔ hɔ doctor betumi gyina saa de nso ayɛ CS ebi nso yɛ sɛ ɔbaa no wawo nkora dodo wawo nkora bebree the first say grand multiparity wawo nkora every 5 ɛkɔ a awodeɛ no tumi yɛ mmerɛ yeah sister Safia you can conceive again utu baako wɔ hɔ don't worry why ɔbaa wo dodo a 5 6 7 8 9 10 ɛkɔ a awodeɛ no tumi yɛ mmerɛ nti no kae sɛ wonyinsɛn no wawodeɛ no koraa bɛtɔ mu a wawodeɛ no stretch contract no stretch duru baabi a ɛtumi nyɛ dɛ especially during labor awodeɛ no tumi pae awodeɛ no tumi rapture nti doctor assess so no awodeɛ no ayɛ mmerɛ a bi ɔha yɛ ma nkɔ into labor ɛno nko a ɛhɔ naa no doctor tumi gyina so sɛ ɔbɛkɔ akɔyɛ cesarean section so grand multiparity wawo efiri enum ɛkɔ menkasa da bia listen good menkasa da bia o menkasa obiara a wawo dodo bia na yɛbɛyɛ CS that's not what I'm saying but per the doctor's assessment utumi ka sɛ maame wei wawo dodo nti ne ba wei deɛ yɛ ma ne ngo mfa n'ase Obi so wa chronic STI. Some when your infection was here, you treat and treat and papa you see a go pampa ya was in man no thing. Doctor to me didn't know consequence you see if we say my plan for was here and try na in more ni be akwa ni na akwa affect akwa no. Into your nose doctor to me didn't so e ka so obey your cesarean session. Baby, good morning, good morning. Nti we are discussing nneɛma a ebetumi ama doctor akɔ akɔyɛ ɔbaa CS. Ebi nso ne sɛ ɔbaa no ne ho yɛ paa ne biribiara yɛ okay biribiara ntɔɔ no nanso wɔkɔ antenatal a ɛnnɛ no yɛasɛse ano no akwaraa no ho mee nyɛ yɛfrɛ sɛ fetal distress ɔbaa no ho mee all of a sudden ɛkɔ soro dodo more than 160 ɛkɔ 180 ɛkɔ 200 1 minute bi a yɛkyɛke a anaasɛ so wate adrɔpe less than 120. Normal fetal heart rate is between 120 and 160, mostly between 120 and 160. If the fetal heart rate need drop it, about 90 something, 100, then drop it, fetal distress. BBC, something must be done, and one of the things that could be done to salvage the situation is a cesarean section. In Tempano, you could shower the year abofrano, now you're doing your share abofrano. And that's how yɛbɛte yɛn na afei akora no heartbeat no na ɛmmɔ biem tiwu sɛ mo a mowɔ ha mu bi wɔ hɔ a obi wɔ hɔ a from nowhere all of a sudden ɔkɔɔ antenatal no yɛsɛ ne ba no nhome biem ne ba no awu atɔ ne yam wanhu ne ntɛm. Can a doctor also consider the age of the woman? I think this is here and over, so the answer is yes. I think this is here and over, so I understand. So these things are all contributory factors. Fetal distress. Then the fetal presentation, or malposition, or malpresentation, whichever way you look at it. Akwan de ne hen na eba, or de ne to, or de ne ti, wa biem, hen or de ba. Nti sa akwan de ne to na eba, na maame a won woda, mostly CS na yema o. Minnu nsu kakra. Aya na CS yema o. Sa won woda, na oba no, or de ne to na eba, wasi kwan ni so a, won woda. Yekoyem chim mekan sisi akra ebeduru baabi na fi akra no na ne ti na lock ne ti no omo bre ansa na omo deliver ne nyina mu no kai se na akra no wo hye hoche na wo ye mre na me anya adoma wo beba no na wo ye mre ebe sum na ankoye yi eno nti pa nti na no doctor stage na se oba no de ne to na eba na se won woda ana wase kwan so wa woda but wase kwan so a ebe kwa koye cesarean section, so it's also an indication for CS. Ebio akra no a oba no wobɛhwɛ ebi a maame no akora ne ti ɛso ɛsene maame n'ase efrɛ no cephalopelvic disproportion akora ne ti ne so maame n'ase kwan ne so a in this case no it will be very difficult sɛ yɛka kyerɛ sɛ kyem a deɛ ɛbɛsie ne sɛ ɔbɛyi ɔde ne ti ne baa na ɔde abɛpem maame no wase hɔ o pelvis no ɔpɛ sɛ ɔwuram ɔntumi nwuram ɔde ne ti ɔde baa na ɔde abɛpem ɔde baa na ɔde abɛpem kai sɛ wɔyɛ sɛ ne nyinaa no it is causing what intracranial hemorrhage or intracranial injury ɛma n'adwene no ho aka wotuma sɛ it eventually sɛ woma ne delay nti na yɛa na sɛ ɔmo ho CPD a yɛmpɛ sɛ CPD na ebe delay akora no n'ase kwan no maame n'ase kwan no so na akora no ti na ɔde ba no so akora no so a yɛma ne delay bebree bi sɛ akora no ɔno ɔba o ɔpɛ sɛ ɔba ɔtry sɛ ɔbɛba nti sɛ labour no prolong a saa akora wɔ even though finally yɛbɛkɔ akɔyɛ CS ayi akora no but akora no bɛtumi akɔ so a adi dɛm. So my sisters on YouTube, what we are discussing is some of the indications of CS, some of the things that could cause CS. And I'm saying that advanced maternal age, if the mother's age is maybe way above 35, maybe 40, 42, 45, and having her first baby, all right, it is one of the things that doctor will consider to, as it were, do CS or assist you to have vaginal delivery. And again, someone who has had more than 5, babies, we call it grand multiparity. If you've had more babies, it sometimes have or has effect on your uterus. So when you get into that stage, a consideration will be, done. Doctor will assess you if you would be able to have a vaginal delivery or cesarean section. We are also talking about the fact that the position of the baby, the presentation, is the baby coming with the buttocks, is the baby coming with the head. All these things could have influence on the delivery of the baby. So the doctor will consider if the baby is coming with the buttocks, sometimes CS will be done. And we're also talking about the fact that when the baby's head or the presenting part, the head, so to speak, is bigger than the pelvis, the baby will find it very difficult to pass through. In this case, in this situation, CS will be the preferred mode of delivery. So that is what we are discussing. We're looking at the things that could, inform your doctor to request or ask you to go for CS to deliver the baby. Nti ɛno ɛna yɛhwɛ no anwummere anaasɛ awia yi baabi a wohwɛ ɛde efiri. Hey, maame me mo aho me so megye so maame adeɛ pɛna. Good afternoon dear. And then previous history. What is the cause of placenta previa? I have had twice, firstborn and now. So, Dr. Ben Carson was say previous history, very, very important. It is true. If you've had CS before, it is also an indication. Previous history. That is very true. Thank you so much. So, placenta previa, it means that the placenta is situated at the lower uterine segment, either partly or completely covering the os. So, the placenta is situated at the lower uterine segment. Placenta, it's right there, no? Atare awodie na no. Either say akata awodie na no nyinaa anaasɛ akata awodie na no baabi. Ate the mission I say. Some of the causes no betumi ayɛ scaring uterus. Awodie no etwa dem, kotwa bi dem, scar. Nti placenta no baabi you feel comfortable na ɔtare yɛ no. Nti bia no ayɛ surgery pɛn. So ɛno betumi ayɛ influence. Ebi a fibroid wɔ hɔ, fibroid na ayɛ kɛse agye awodie no. Nti placenta no baabi of finding comfort ɛna ɔkɔtare yɛ. Ne nyinaa yɛ predisposing factors and that's a cause of previa. Ebi nso hɔ a saa nneɛma no nyinaa nni hɔ. But the placenta find it very, very comfortable attaching itself there. Now, one thing about previa is say in early stages, I am very, very mechanic say it's something that shouldn't be of concern. I mean, cancer in the initial stages of the pregnancy, the early second trimester. No? They are 20 weeks, 24 weeks, 16 weeks, 18 weeks. If you've diagnosed of placenta previa, if you are not bleeding, not having any severe pains and things like that, I am in time hardening. If you say, means I need now, why would there no air stretching, uterus no air stretching, another air expanding? No? It means pushy placenta no kosoro. The placenta is able to push up as the pregnancy advances, as the uterus expands. In the early stages, no, the diagnosis placenta previa, but means any be calling baby. Over scan no, na a free low line, and I say a free lower uterine segment, the upper part of the uterus. In case previa no be. However, the previa no at around 32 weeks, 34 weeks, still a previa there, then that is it. In the better the type. Is it too close to the cervix? And I say, is it far away from the cervix? And I say, is it covering the os? And I say, far away from the os. And not be informing your mode of delivery. So then that one, no, it is non-negotiable. CS will be done. So in kata audienam kasinemum a form a low line, all right, but in kata audienam they are not bleeding. Sometimes, but that is type 1 or type 2. Vaginal delivery may be possible. In the case of type 1, and it's a form of there's one kata audienam. But type 2, no, a real one but service limit but I say, and also vaginal delivery could be possible. I would have to know, dear, welcome. Type 3, type 4, there is straight up CS. And so when I say grade 3, grade 4, and as a type 3, type 4 placenta previa, no, it is non-negotiable. CS will be done. Type 2, they will assess you. It may or may not be possible. But type 1, they mostly you are able to have vaginal delivery. So and also your indication for CS. And if remember could be placenta abruptio. And the who ye papa. Hello, yes, I speak English. I speak English as well. We are discussing cesarean section, some of the indications for CS. So we are looking at some of the things that could, you know, inform your doctor to, as it were, request for cesarean section. That is what we are discussing. Talking about the indications. What are some of the things that could, you know, oh, you didn't understand. Okay, so where are you from? Where are you watching from? Seb Hassan. Where are you watching from? Where are you? Are you pregnant? Are you? And the baby you hane. Ah, boys again. Okay, Yanko. You are watching from England. Okay, okay. So we are discussing things that could, you know. Uh, oh, you are not pregnant. Okay, okay, okay. That's fine. That's fine. That's fine. So that is what we are discussing. Okay. And then you see about enema. A bit me and my doctor. Apa you be. Hey, let me so 150. So we are discussing about cesarean section. Have you heard about cesarean section? You are a boy. Oh, don't worry. Okay. Okay. Don't worry. Don't worry. Enti yɛnhwɛ enti yɛkɔ yɛn anim no yɛfrɛ baako thanks for watching boy placenta abruptio ɛno deɛ ɛhu papa ɛno deɛ premature separation of the placenta okay from the uterine wall premature separation yɛn nyinaa yɛnim sɛ ɛnka berɛ a ɔbaa yɛhwɛ anim sɛ wɔ placenta akyirɛ adeɛ no bɛwae ɛyɛ berɛ a akwaraa no aba awie berɛ a akwaraa no yɛyi akwaraa no na o midwife anaa doctor ɛyɛ dɛn ɛdeliver placenta no. But there are some cases that there be and kosa. But I'm share live and why? If you are on YouTube watching, just keep the likes coming. Share the live as well. Keep the likes coming. Share the live as well. Who say? Emojano. Ho. It's not the name why. In emojano. Yunuba. So what ye emojano ebano. A bed peer free wase. I'm a walk who say emoji too. Of course. Or baby, when you emoji too no. Baby brain. Or obegania hospital. Fashion trim say obanyima on menstruate. Many about here some way ye be sensitive ye. Because can you hear me talking? Can you hear me? Can you hear my voice? Can you hear me speak? But I'm not as some way I make hear me papa. Will be about first time hear some information we. Me say obanyima sister on menstruate. If you are first time here listening to this a year, but you're obanyima on menstruate. There's no menstruation during pregnancy. And so when you know who it means that you have to report it for proper investigation to rule out any impending risk or complication. Obanyima on menstruate. You see, can I know something that what's the meaning? That me menstruate fa ho. Me menstruate. Me who me yin send them say me nyam ye not la na me menstruate. Ye taate pa na me menstruate bra. Me nyam so me da so menstruate because ye nua no ma no dodo no moja bi obehu afiri na se bia no o se ye menses. Ene na nim de ekoso enom ne ade ade ntini pa ete ne me bia se. Tane no oba moja bi oba behu bia no o se wo menstruate. So ntimi pa chaw wonyima don't talk about menstruation. If you bleeding bia e betumi aye saa de ya kan bia tiye e betumi aye saa de ya kan bia placenta abruptio premature separation of the placenta. Now there are some cases the separation is happening all right, but the blood will be collected between the placenta and the uterine wall. It will not come out. If we know concealed type of abruptio, it is the dangerous type. The concealed type of abruptio. O placenta na why? Na why no moja ni gu placenta na baby why no pe. E ma bontin. Nti anu sa ni mpem bebrede bi a wo nti wo ye oba wonyam. Now tell who say, oh, all of a sudden, your tummy is very painful and tender to touch. And cancer just remember life, no baby same. In any case, all report to hospital. Now you say, BB we okay, you don't lose anything. The abdomen feels tender and painful to touch. You have to report it. My sister, Afia, welcome. Oh, all of a sudden, we're free now. Year time, because you say and call and be brisa. But we're free now. Year time. What was that time? What was that? Free we ya. What was that? Can I we ya? Sister, don't wait for somebody to come live. Not saying me could be son. Run as fast as your legs could carry you and go to the hospital. But you're the American. Here pa. Say so. Emoja na wo hu a. Ya no de wo be run ntem. Nti nka sɛ o menyem baako no koraa no sometimes ade wei na ha mo mu bi no menyem baako koraa no na menyem no na mogya tumi nkakra nkakra na saa mogya mede kɔɔ hospital koraa doctors no sɛ ɛnyɛ hwee ɛnyɛ da biara na ɛbɛyɛ ɛnyɛ hwee wote deɛ mekyerɛ no yes sometimes no even sɛ wonyem koraa the cervix becomes very vascular rich with what blood mogya taa ba wo cervix nti no ɛwɔ hɔ koraa wotumi delidi kakra kakra from the cervix ebi so hɔ na nyinsɛ na yɛ threatened ebi so hɔ na yɛ implantational bleeding ebi so hɔ na yɛ bibi ebi so hɔ na yɛ ectopic nti let us rule out any impending complication or risk ɔsi low lying anterior placenta the placenta is low lying if the placenta is low lying we are talking about previa so they have to define the previa to your sister they will check for her if the low lying is type 1 type 2 type 3 sister I would actually the no na make ho asem eben I would na no until they will inform her if it is something that is of concern so I can't make emphatic statement meaning the type 1 type 2 type 3 type 4 if it is low lying they have to explain to her the type so whichever way she's safe once she's under treatment and as a monitoring no there's nothing to worry about I said that is what I'm going through sharp pain and tenderness because of fibroid I'm 13 weeks pregnant of course see I know the one who say a fibroid now sometimes fibroid don't air shrink here but I'm talking about the fact that if you don't know the cause you have to report it to be assessed yeah assessed so who say oh and you be very very important so what I say you don't stay at home and say oh normal it be an normal so abruptio placenta is one of the indications of what cesarean section you the whole in straight up to the theater na yakwa kwa yo CS no abofra no de ma saa nneɛma wei nyinaa itimi inform wo doctor ma no kɔkɔyɛ cesarean section obi so hɔ na gestational diabetes uncontrolled one doctor timi kɔyɛ CS yi akra no ebi so hɔ a na wo the pregnancy induced hypertension anasa preeclampsia ɛno so itimi ma yɛ control na in control a doctor timi gyina no so ekɔyi akra no saa nneɛma wei nyinaa ɛyɛ causes anasa indications a ɛbɛma wakɔ akɔyɛ dɛn wakɔ akɔyɛ CS ɛnti CS no ɛnyɛ adeɛ bi a in most cases no ɛyɛ adeɛ a wontumi nyɛ ho hwee ɛno na yɛbɛyɛ de ayi wo ba no ama wo ɛno na yɛbɛyɛ ama wo ba no aba abɔnten ɛno na yɛbɛyɛ ama wawo yɛhwɛ wo sɛ kɔwo fa wɔ for example in the case of placenta abruptio na wo sɛ wakɔto sɛ obi ka sɛ ɔwɔ aduru a wobɛtumi de ama wo ama yɛnyɛ wo CS na wo case no yɛ placenta abruptio a wo sɛ wo doctor no ntwɛn ɛma placenta abruptio no placenta no nwa nwie na wo ba no nwu wɔ wo yam na wo maame no so wunwu because obi ama wo duro sɛ yɛn wokɔ akɔwo no yɛnyɛ wo CS sister is that what we want saa ɔmo yɛ saa no nyinaa ɛyɛ psychology na ɔmo yusu ɔmo de ɔmo adwen yusu na ɔmo de ebiti mo ɛnyɛ sɛ saa na mo pɛ yɛɛ deɛ wanyem bɛyɛ 40 weeks unfortunately in an unlikely event placenta na ɛwae na yɛsɛ akwaraa no a placenta na ɛwae no ɛma ne home asi ɛma akwaraa no ntumi survive wo sɛ obi ama wɔduro sɛ wokɔ akɔwɔ no yɛnyɛ CS anaa ɔsɔfo bi no wabɔ mpaeɛ sɛ wotwa CS mu nti ɛno nti no nkɔ hospital mpo no yɛakɔ akɔyɛ sɛ nkɔhwɛ wo woba no bi wɔtɔ yam wo nso nyame anyɛ wadom a yɛbɛhwere wo sɛsiaa or in the case of if we be cord prolapse. Cord prolapse. Yen nyina yenim say enka ye wo akora wi a na nka cord no ye yi ene placenta no. But say when the membrane ruptures, akora no nsuo no dem no a pipe and then the cord is in front of the presenting part. Inti yemfa ne say mma memfa me bayi mra na yenhwe ade bi wa ha. Just a minute. Yenhwe ne say. Yenhwe ade wa ha. Akora ne ti no de ba na akora ne ni. Wohu. Nsuo na akora no dem na pai. E na akora no cord ne ni. Akora no cord na besensen wo say. So we are friend cord prolapse. The cord has prolapsed. A pie. Zubo sa ba besensen oba na se. Akora ne ti ni nyamayo. But cord na dikan. Nti saa de we. Ebetumi aba se akora no obetumi ayeden. Obetumi ahwere ne nkwa. Ebri se akora ne ti ebetumi abemia vaginal walls no na emia cord no. Na emia cord no. Na emia cord no. Enti se cord no so na akora no home fam. Se bo akora no manitim home. Eventually, ebetumi ama akora we ontumi enhome. Akora no be hwere ne nkwa tesi a. In the case of cord prolapse, it's dangerous. Enti se maame wo ho all of a sudden, won say ye ma maame ne nda in a position a you can say simple. Sa position try there. What is the position? So me refer that position. We be boa me. They say your man eda ho as we butu ho na ye de go hospital. Say the bear be prevent the descent of the baby. Emma planning descend. Emba e form. Ye yes ani na ye dimirika na ye de akra no eko maame na eko hospital. Ya fere no hospital ntaman ko yes a ye be hwere sa maame no. So sani ma we nyina ye indications. Be me yakwa ye obi cesarean section. Mama yen hye nso. Enti the person may conclude about the indications. They say CS is done only when it is needed. Dr. Bianco you CS wabra in here. CS is done when it is very, very important.